Whether you pronounce it tinnitus or tinnitus, this auditory hallucination can drive someone crazy. Tinnitus is a phantom sound that a patient hears in their ears or in the center of their head. It can present as a ringing, buzzing, whooshing, roaring, clicking, hissing, or humming noise in one or both ears. The noise may be constant or come and go. Tinnitus affects about 20 to 30% of people. Tinnitus isn't a condition itself, it's a symptom of an underlying condition, such as an age-related hearing loss, ear injury, or a circulatory system disorder. There are two types of tinnitus. Subjective tinnitus is tinnitus only you can hear. This is the most common type of tinnitus. It can be caused by ear problems in your outer, middle, or inner ear. It can also be caused by problems with the hearing, auditory nerves, or the part of your brain that interprets nerve signals as sound, auditory pathways. Objective tinnitus is tinnitus your doctor can hear when he or she does an examination. This rare type of tinnitus may be caused by a blood vessel problem, a middle ear bone condition, or muscle contractions. Whether the tinnitus is a recent onset or if the patient has been experiencing tinnitus for years, it is important to be evaluated by a doctor of audiology. We are the tinnitus experts. While there isn't a cure for tinnitus, this does not mean that tinnitus cannot be managed. There's no cure for diabetes either, but doctors don't tell patients that there's nothing we can do about that. In most cases, the underlying root cause of the disorder is hearing loss. It does not matter if the hearing loss is temporary. This may be the case if the patient has impacted earwax or an ear infection, or if the hearing loss is permanent, such as nerve damage. Addressing the hearing loss itself is the best way to manage tinnitus. By giving the missing sounds back to the hearing center of the brain, we can sometimes retrain the brain to not produce the tinnitus. We're saying, hey brain, here's the sounds you've been looking for. Now, the human ear hears between 20 and 20,000 hertz. Hearing aids just look at 250 to 8,000 hertz because those are the frequencies important for speech and communication. So we're not correcting hearing loss above or below the speech frequencies. Patients could still have decreased hearing in those sections, and the hearing aids alone may not be enough to eliminate the tinnitus. This is where other strategies such as sound therapy or cognitive behavioral therapy come into play. We work with patients to give them tools to help them manage their tinnitus. While a medical condition, like the hearing loss itself, may be the actual root cause of the tinnitus, there are still environmental triggers that could come into play. Certain foods or medications could potentially be exacerbating the issue, causing the tinnitus to be louder or more intense some days versus others. This is why we have to look at the patient as a whole person. Your body is a finely tuned precision instrument, and if one system is not working properly, it could affect how the other systems are working as well. If you or a loved one suffer from tinnitus, we are proud to partner with the American Tinnitus Association to offer free monthly support group meetings, as well as a Facebook group called Claremont Tinnitus Support Group. Reach out to us at Citrus Hearing Clinic for a tinnitus evaluation. We are here to help.